Welcome to this explainer. Today, we are diving deep into the massive, frankly mind-boggling machine that is the modern healthcare industry. We aren't just looking at doctors and stethoscopes here. We're popping the hood to look at the massive operational backbone that keeps these life-saving institutions running day in and day out. Think back to your last visit to a hospital or clinic. Actually, scratch that. I want you to view it not as a patient, but as an observer of a giant living ecosystem. Ask yourself, what does it actually take to measure the true impact and sustainability of such a colossal operation? Like, how do you even begin to measure its environmental footprint, its digital security, or the safety of its own workforce? Well, to answer that, we're unpacking the official guidelines from the Sustainability Accounting Standards Board, or SASB. Now maintained by the ISSB, these standards provide the data-driven vital signs for this entire sector. They give us the exact metrics that healthcare entities use to disclose their sustainability-related risks and opportunities. It's kind of like a master blueprint for the industry. So here is our agenda for today's anatomy lesson. We'll be looking at defining healthcare delivery, managing environmental impacts, patient care and privacy, pricing and accessibility, workforce health and governance, and finally, climate risks and preparedness. Okay, let's jump right into Section 1, Defining Healthcare Delivery, Understanding SICS Code HCDY. In the world of sustainability accounting, we use the Sustainable Industry Classification System, and specifically, we're talking about SICS Code HCDY. This code, healthcare delivery, refers exclusively to the entities that actually own and manage hospitals, clinics, and other healthcare-related facilities. These organizations face extremely high fixed labor and facility costs, plus, as you can probably guess, intense regulatory focus. And the scope of services provided by these entities is just huge. We're talking inpatient and outpatient care, surgery, mental health services, rehabilitation, and clinical laboratory services. The demand for all of this is driven by shifting demographics, illness rates, and insurance coverage. It's a massive umbrella, which makes measuring its sustainability a really unique challenge. Which brings us to Section 2, Managing Environmental Impacts, the physical footprint. Look, running these facilities is incredibly energy intensive. They operate 24 hours a day, 7 days a week. To measure this, entities are required to precisely track their total energy consumed in gigajoules. They have to report the exact split between grid electricity and renewable or self-generated power. Because honestly, improving these efficiencies isn't just good for the planet, it directly limits their exposure to volatile fossil fuel prices. Now, what's really interesting here is the sheer complexity of hospital waste. You can't just toss everything into a dumpster out back. The standards force facilities to strictly separate hazardous pharmaceutical waste, which is anything ignitable, corrosive, reactive, or toxic, from non-hazardous waste, like standard garbage or facility sludge. Furthermore, they have to report exactly what gets incinerated, recycled, treated, or landfilled. Since disposal fees for regulated waste are incredibly high, finding better segregation strategies directly impacts their bottom line. Let's shift gears a bit. Section 3, Patient Care and Privacy, the nervous system of healthcare. Imagine, just for a second, your personal health data, your medical history, literally your most private information, being compromised. It is an absolute nightmare scenario. So, how do hospitals measure and prevent this? Well, facilities are required to use strict administrative, physical, and technical safeguards. But, when things do go wrong, total transparency is mandatory. Entities have to disclose their total number of data breaches and then categorize them. Did the breach involve just personal data or highly sensitive personal health data? They must report the number of unique customers affected and, critically, the total monetary losses from any resulting legal proceedings. It's a metric of trust just as much as it is a metric of security. But beyond digital data, physical safety is absolutely paramount. Quality of care is the ultimate value driver here. That's exactly why regulatory authorities track serious reportable events and specific hospital-acquired conditions per facility. Entities have to report incidence rates for things like healthcare-associated infections, pressure ulcers, in-hospital falls with hip fractures, and post-operative sepsis. Tracking this ensures management is focused on, actually improving healthcare outcomes. Next up is Section 4, Pricing and Accessibility, the cost of care. So the crucial point is that high-quality care also has to be accessible. Healthcare entities face unique challenges in serving uninsured and low-income populations. The standards require these organizations to deploy and disclose their strategies for managing patients across all insurance statuses, whether they're private, government-sponsored, or uninsured. This includes rolling out innovative pricing structures, sliding fee schedules, or indigent care programs. And then there's the whole issue of billing transparency. To combat billing confusion, standards require entities to disclose the number of their 25 most common services that have publicly available pricing. They want to make sure patients are adequately informed about the cost before they ever go in for a procedure. Section 5. Workforce Health and Governance. The lifeblood of the machine. This whole complex machine would completely grind to a halt without its workforce. Entities face fierce competition and have to closely track retention by comparing voluntary turnover, meaning employee-initiated resignations or retirements, against involuntary turnover, like entity-initiated dismissals or downsizing. And they have to track this across physicians, non-physician practitioners, and all other staff. Systemic governance risks are also heavily scrutinized. We're talking about tracking total monetary losses due to medical fraud, like upcoding, unbundling, or kickbacks. Entities also have to manage the prescription of controlled substances with strict tracking and opioid antagonists. And finally, because healthcare can be surprisingly dangerous work, they track workforce safety through a total recordable incident rate for both direct and contract employees. Finally, Section 6, Climate Risks and Preparedness, the Future Prognosis. Let's look at how this industry must adapt to an evolving world. Climate change presents severe physical threats and logistical challenges to human health. Hospitals must have detailed emergency preparedness plans. And this isn't just about physical infrastructure risks from extreme weather. It's about treating shifting human health impacts. That means building added capacity for heat-related illnesses, treating waterborne diseases like cholera from increased flooding, and even preparing for disease profiles like malaria shifting into historically non-tropical regions. Which brings us to a critical final question. Now that you've seen exactly what it takes to measure, regulate, and run these massive facilities, from tracking gigajoules of energy and waste to data breaches and shifting global diseases, how confident are you in the resilience of our health systems? As climate and digital threats evolve, is our healthcare infrastructure truly prepared to care for us when we need it most? Keep asking these vital questions, and thanks for exploring this with us.